My name's Evan Lyon. I'm a volunteer doctor with Partners in Health, and I've been working on health in Haiti for over a decade. You know, as we first walked in that first day into the hospital, it was an incredible scene. There was very little going on in terms of medical care. There were 2 makeshift operating rooms in the corner of a building that was left undamaged. There were hundreds of people lying around with big injuries, bad injuries, broken legs, broken arms, compounded fractures where part of the bone comes out of the skin, and so we went to work and have been working ever since, and have been watching things change and watching things get a little bit better day after day. I think one of the biggest issues in terms of losing the chance to help people was our electricity. You know, we didn't have enough electricity to work 24 hours a day, so that cut our time in half, and we had less opportunity to work and potentially save people's lives. I wasn't here to see the many thousands or tens of thousands who died immediately after the earthquake. We know from our work and from driving through the city that hundreds of thousands of people are out of their homes, and by the time this all settles, there'll be hundreds of thousands more.
We have nowhere to stay. We were here in a tent, and every time they tell us it's time to go, we become terrified. We went to a second tent. We were next to the hospital courtyard. When they told us it was time to go again, we had no idea what to do. We have nowhere to go. Since the earthquake on the 12th, we've been homeless.
The Haitian staff has been incredibly strong, incredibly dedicated to helping their hospital get back up on its feet. The Haitian staff has also been incredibly traumatized, and it's a very few number that have been able to come back to work after losing their homes and losing their loved ones. We don't even know how many people from the hospital staff have died. We don't even know. Can't put a number to it.
The government needs to do something for everyone. The international community has to do something for everyone who has been affected. Absolutely everyone. Everyone is a victim. If the Haitian government or the international community doesn't help the Haitian people, after a few months there will be an outbreak of mental illness. So many people will suffer mental illness. From the rich to the poor, everyone has been affected, and everyone is at risk.
Major next step I'm worried about, just as a human being, is all these people who are left out of their homes. They have to be given the basics: shelter, food, water, health care.
My foot has been amputated, and I know I can't work. And I wasn't raised to be a person to always be asking, please, can I borrow 50 gourds? Please, can I borrow 25 gourds? If that's how I'm going to end up, if I have to ask for every meal or depend on the charity of others, I would have asked God to have taken my life. He just should have taken my life during the earthquake. I never want to be on the street begging, having to ask, give me 25 gourds. Please, give me 50 gourds.
This time, everybody in the whole country's been affected. I think people around the world and people in the United States need to think about Haiti as a whole place that needs schools and water systems, needs the land to be rehabilitated so that trees can grow and food can grow. I'm a medical person and I care about health care, but that's a very small piece of the puzzle compared to what really needs to happen. All this stuff needed to happen before the disaster. All this stuff, for those of us that care about Haiti, all this stuff was urgent before this catastrophe. And now it's even more urgent.